To become a neurosurgeon, first you must become a doctor. To do that, you start by completing a bachelor's degree at a four-year college or university. Being that medical school is highly competitive, you'll really want to focus on keeping your undergraduate GPA above 3.75, and you'll want to either major in a science or complete all of the science prerequisites necessary for medical school. Once you have completed your bachelor's education, you need to take what's known as the medical college admissions test. All applicants to medical school must take this test, and it covers the physical sciences, biological sciences, verbal reasoning, and written communication. Medical schools use your MCAT scores, your GPA, course of study, and college you attended, along with other applicant information, in assessing candidates to medical school. If they believe you're a viable candidate, they will grant you an interview, which is really a critical step along the process. Once you're admitted to medical school, you begin an additional four-year course of study. The first 2 years of medical school focus primarily on didactic instruction in health sciences, and the second 2 years focus on teaching clinical knowledge and skills. Along the way, you'll have to pass both parts of the United States Medical License Exam, or the USMLE. Step 1 covering your basic knowledge of health science, disease process, and treatment modalities, and Step 2 covering your competency in clinical skills. Once you've completed medical school, you'll be granted the degree of MD. But before you can practice as a neurosurgeon, you will have to apply for a neurosurgery residency. Now, neurosurgery is one of the disciplines that has their own residency program, as opposed to the national match. You will apply to a residency program in neurosurgery, much as you did to medical school. And once you are accepted, you will begin an additional 6 to 8 years of graduate medical education, during which you will first learn how to become a surgeon, and then how to become specifically a neurosurgeon. Given that neurosurgery, or surgery on the brain, is a very complex and technical process, it is a very arduous residency program. But upon completing your residency in neurosurgery, you can sit for the state board exam in the state in which you wish to practice, and you will be ready to practice medicine as a neurosurgeon.